Welcome to the second day of the conference. We thought you might like that sort of scratching on the chalkboard way to start your day. So now we've got all the tough stuff out of the way. I'm Emily Moore. I'm the Executive Director of Feed My People Food Bank, serving 14 counties in west central Wisconsin. I hope everybody had a great first day and evening of connecting with others. I think what's exciting about this conference is that it draws such a unique blend of constituents. I know you're all such data people that I don't know if you remember when you filled out your registration forms that you checked off your primary sector affiliation. So I thought you might like to know the who's in the room story. There are 35% from the emergency food sector, 28% healthcare, public health, 11% business and agriculture, 10% academia, 8% government, and 5% from the policy and advocacy organizations. Many of you indicated sectors, multiple sectors, and after your primary one, which suggests to me that we have attendees that are diverse, multifaceted, and have that silo-breaking expertise to help us as the conference theme is breakthrough. Great group. I'd like at this time to thank our 2018 exhibit sponsors, or exhibit partners. We have the Brown County Food and Hunger Network, Farm Fresh Atlas, the Center for Integrated Agriculture Systems, Nelson Institute for Environmental Studies at UW-Madison, and the Wisconsin WIC program. Let's give them a hand. Please be sure to take a moment to visit them in the exhibitor area, where, by the way, you can also learn more about the Feeding Wisconsin food banks. I'd like to thank the USDA Food and Nutrition Service for co-sponsoring the Food Share Outreach sessions at the conference. Food Share Outreach is an important program that helps connect income-eligible families with the information they need to apply for nutrition benefits. We really appreciate the opportunity to continue this important partnership with the USDA and the Wisconsin Department of Health Services. Finally, I'd like to thank the Wisconsin Local Food Network, this year's planning and content partner. We are pleased to have this partnership that really allows us to dive deeper into issues surrounding food insecurity and health, and also to help us better understand the inner workings of our local food system. Please join me in welcoming Craig Zahn, Wisconsin Local Food Network Board member and farmer at Circle Union Farm.
Thank you, Emily. Good morning, everyone. On behalf of WLFN, I'm thrilled to be here and thrilled to partner with Feeding Wisconsin in the shared mission of healthy food for all. Yesterday we had a great opening session. We were almost overflowing. It was a chance for us to sit down with a panel and talk about issues of connecting with community, and breaking down social and racial barriers. And one of the things that came out of that session was it's really about building relationships and listening to each other. And so we're taking that to heart. WLFN and our collaborations with other partners, we're going to continue to listen and work on these issues of building a healthy food system for all. Other sessions that we had 2 other sessions on yesterday. We had a great session centered around food policy. We had Nick Heckman from Dane County and George Riestad from the city of Madison, and we really dug into some discussions on how to move forward the discussion of a statewide food policy, some type of food policy network or council. We were lucky to have Tim English from USDA join our DADCAP discussion, and we dug into logistics of getting food to food pantries. and also some of the logistics of the farm to school, farm to institution. Later today, we have sessions on capacity building and networking, farm to institution, a session devoted to that, and farm to school. And we're thrilled to have such a great representation from the AmeriCorps group that's here of young people. And then lastly, there's a session on building supply chain. So again, I just want to thank Feeding Wisconsin for their great participation and involving us, and we look forward to many future collaborations. Thank you.
Thank you, Greg. It's my pleasure to start the morning discussion panel. This panel time is, at our conference, is always one of my favorites because it gets me thinking about my work in new and interesting ways. I expect this year's panel, Breaking Through to Build Strong, Healthy, and Equitable Communities, will be no different. Dr. Michelle Graham will be serving as the moderator. I can't think of a better person to lead the panel discussion. She is the president of the Medical Society of Milwaukee County and also serves as the Chief Medical Officer for Wisconsin and Michigan for United Healthcare's Clinical Services team. Dr. Graham leads the clinical services quality and affordability initiatives across the market. She is passionate about population health, quality improvement, medical education, and providing care for the underserved. She also serves on the Feeding Wisconsin Advisory Committee. Please join me in welcoming Dr. Graham to the stage.
Thank you, Emily. Can everybody hear in the back of the room? Okay, that wasn't really rousing. Good morning, Wisconsin! Good morning! That's a lot better. This is meant to be interactive. I know it's early. So the theme of this conference, as you heard, is Breaking Through. It was picked by the conference planners because in a world of continuing diminishing resources, our ability to break our silos, to work together and effectively collaborate, and I go back to effectively collaborate, will be so important in our ability to break through, in our efforts to fight hunger, improve health, and strengthen communities. So you might wonder why the CMO for United Healthcare and the president of the Medical Society for Milwaukee up here moderating a panel about this. There's a lot about that history that brings me here as a real honor and privilege to serve as the moderator for this panel. This is my second year in coming to the conference, and after having served on the advisory committee, I can't think of a more privileged position to be in, to invite all of you eventually to talk with and ask questions of our panelists, to figure out how we leave this room we can lead better than we are today, because we'll figure out a way where we've met a new person, or we figured out something that we can do to truly have an impact on those who are less fortunate than we are. We put together a great panel who represent a very diverse group of interests. They're working to build strong, healthy, and equitable communities, and they conceptualize how we can come together across organizational silos in order to break through. So with no further ado, I'd like to introduce our panelists. I'm going to invite them all to the stage and then talk about their backgrounds. Mr. Ralph Beck from United Healthcare, Mr. Robert Campbell from Feeding America, and Ms. Tatiana Maeda from 16th Street Community Health Center. So a little bit of background, and then they're actually going to begin by introducing a little bit more about themselves and talk for about 3 to 5 minutes about breaking through to build strong, healthy, and equitable communities. So you'll get to know a little bit more about them in the intros I'm going to provide. Then we'll start out with some planned questions, and then of course we'll be opening it up to all of you to ask them your most interesting, how can we leave this room better questions. So, Mr. Ralph Beck on my far right joined United Healthcare in August of 2007. He previously served as the Vice President of Marketing and Strategic Planning for the Wisconsin Health Plan from August of 2007 through October of 2009, and later as Regional Vice President of Sales and Marketing for Central and West Region Health Plans until March of 2012, when he became, and is currently the Chief Operating Officer for United Healthcare Community Plan of Wisconsin. Ralph has been a health insurance executive since 1990, and prior to joining United Healthcare, held local and regional leadership roles at Wausau Benefits, Blue Cross Blue Shield United of Wisconsin WellPoint, Humana, and the Maritime Insurance Group. He also serves on the board of Feeding America Eastern Wisconsin. Mr. Ralph Beck. Mr. Robert Campbell is the Policy Director for Feeding America. Robert manages their public policy development and strategy for federal nutrition programs, including SNAP and child nutrition programs, as well as other issues important to Feeding America's network of over 200 food banks and millions of individuals and families facing food insecurity. With Feeding America since 2009, Robert has been working on domestic food security and poverty issues directly or indirectly for more than 15 years, including time at FRAC, the Food Bank of Central New York, USDA's Western Regional Office, and with the Government Accountability Office. Robert has an MPP from UC Berkeley and lives in DC with his wife, 2 children, and new puppy Shadow. Mr. Robert Campbell. And last but not least, Tatiana Maeda works at 16 community health centers in Milwaukee since 2010, where she developed and currently manages Healthy Choices Department, an obesity intervention that focuses on comprehensive family education, community leadership, and environmental changes that increase access to healthy food and safe physical activity. Tatiana has served as a board member for the Nonprofit Center of Milwaukee and the Milwaukee Food Council, and currently serves on the Leadership Council of Health Tide and the Bite Pedestrian Task Force of the City of Milwaukee. Her main passion and expertise are in the areas of health equity, community engagement, program development, and Latino cultural competency. Originally from Bolivia, she has a bachelor's degree in communications and a minor in community development. Her experience with social and nonprofit work began in Bolivia, her native country, where she worked for several organizations dedicated to rural and indigenous communities. So without any further ado, enough from me, we're going to hear from our panelists. Our first question is really around how would they discuss addressing the challenges and opportunities in building healthy and equitable communities and the opportunities they see toward breaking through the challenges and toward a path forward. Mr. Ralph Beck.
Well, good morning, everybody. Thank you for joining this conference and giving us an opportunity to present some information to you. On behalf of United Healthcare, I'd like to share some initiatives and innovations that we're pursuing and why we are deeply involved in trying to help solve the social determinants of health. And one of the things that I'd like you to understand is one of the key missions every day for United Healthcare is we focus on helping people live healthier lives. We also want to help people learn to navigate the health system. Now, you might be wondering, why are we as a health insurance company focused on attempting to do this? And one of the things that's important to understand is that our American healthcare system is going through profound healthcare changes. And for many people, it appears fragmented. And for many people, it is hard to navigate if you're trying to assist anybody like your parents and your friends. And one of the things that's important to us is achieving our mission, and that mission has never been more important than it is today, and here's why. As a company ourselves, we serve more than 50 million American citizens across the country. And our success is measured in our ability to respond to each one of those individuals with a level of compassion. And why is that important? As the nation's largest healthcare company, we do play a critical role in helping to make sure that we can provide access to better health care for the members that we serve, for the underserved, and for the uninsured. We have set ourselves a very, very large agenda. And one of the things that we're attempting to focus on and accomplish is to improve access to health care for 1 million more Americans in 2018 who are uninsured and underserved. And that goal also exists beyond 2018. That's a huge agenda for us to accomplish. Now, why is this important? We're not just trying to define about how we change access to care, and it's not just clinical care that we're focused on. We are truly focused on trying to change access and the impacts to individuals so that we improve their overall health care and quality of life. And for us, it's now beginning to focus on things like housing, food, improving transportation, and even things like improving social connections with individuals, removing social isolation for individuals who are seniors or for disabled individuals. One of the things that we're attempting to work on is working closely with individuals on the front lines of healthcare to improve that capacity access, and more importantly, to help create innovations and solutions to improving better healthcare and access for the underserved, the uninsured, and for the general population. So those are just some of the things that we're doing as United Healthcare. We're not just a healthcare insurance company. We are here to help solve social determinants of health, and we look forward to partnering with all kinds of different organizations such as yourselves. Thank you.
Thank you, Rob. Next, we receive questions. We'll move on to Robert, again addressing the challenges and opportunities in building healthy and equitable communities and the opportunity toward breaking through the challenges toward a path forward.
Great. Thanks, Michelle. Good morning, everyone. So I wanted to give a few thoughts here. Down just a little bit. To frame the discussion, we can get into more of this both in later pre-planned questions, but also in some dialogue with you all. A couple of things I just wanted to highlight. I was thinking through different approaches and things that are happening internal at Feeding America, things that I see across our diverse network. A couple of takeaways and kind of themes to pull out and highlight quickly. One, look internal, right? Ask hard questions, and then listen. Really listen to the answers, because it might challenge everything we've been doing and how we've been doing it. And we can talk later, we'll talk throughout this conversation, that these are not easy things to do, but the first step is to start. So we'll do that. So a couple of ways that's manifests itself, and I'll focus kind of on our national office and a national network, national office at Feeding America, the work we do with our network. So I'm a dietitian by marriage, and my wife spent most of her career also in the emergency feeding network. We worked at a food bank together for a time in upstate New York, in the Syracuse area. And this is 15, 20 years ago almost, where having a conversation around nutrition in an emergency food setting was different then than it is now. And there's reasons that it's different now than it was then. And some of that was, there's a lot of on-the-ground nutrition education. One of our first dates actually was doing a nutrition education cooking class in elementary school, right? Accidentally dumped out the fried rice, or the rice for the fried rice on our way in. That was not a good impression. But finding ways to build on what we learned from each of those little interactions. And in those little interactions came, novel questions like, what is it that you need? Right? What food do you need to have a healthy life for you and your family? Right? It's not that those don't happen naturally, but they hadn't happened maybe formally and systematically. Right? So the food bank there surveyed the network, surveyed the clients that they were working with, the people who were touching the system, and learned what people needed. And that did, fortunately, largely that matched up. It was what people wanted was fresh produce. They wanted lean meats. They wanted milk. They wanted dairy. Lower down the list were some of the unhealthier things. So it's not that we weren't going that direction, but that kind of information, listening to what came back, allowed them to. And there's been a parallel, in fast forward 15 years or more, where even Feeding America has incorporated some of those types of questions into broader surveys, where we're asking individuals what they need from us. Right, and then let's be clear, the next step can be really challenging, and then maybe figuring out what's needed, and that's led to a lot of other hard conversations where, and I heard this in what Greg mentioned earlier, both in listening to what's needed, but also in kind of maybe actually starting to implement some of those things, right? So where we are now nationally, we've been increasing more and more fresh fruits and vegetables, fresh produce, for instance. There's a challenge. We're running into some logistical hurdles to actually do more of the things that people say they want and that we want to do. So it's having conversations then with those that we serve in our network, with our food banks, with others who are part of getting a good from beginning to end, right? So whether it's working on capacity, infrastructure, having some of those conversations, what do we need to do different, and how we've funded or fundraised to support different things to move the needle in a certain way. So I think we can challenge ourselves to both ask what people want and then respond. The other parallel, more in the work that I do, sitting in Washington D.C., looking from a kind of national policy perspective, is largely what was just mentioned, where if we're really digging into food insecurity to hunger, we've done a lot of conversation. We have a lot of conversation around this up and down our network and with individuals, with partners. Not surprising, food insecurity is an issue where it's at its core a lack of resources. Right? People don't have what they need for their food portion of their life, which is never in isolation. Right? So we are similarly having really important conversations around how do we go upstream, whether it's in the healthcare system to make sure that the food they're giving is working to their benefit overall, not just in a short-term setting. What else about those individuals' lives should we be a part of? Should we be a part of conversations to help address? Can we create better and different partnerships to find stable housing so the resources that they're using can be more toward food? Or if we can provide food, can we free up additional resources for them to help stabilize other parts of their lives? So these are cross-sector conversations that are vital, that are important. So just to say, there's a lot of similarities, and I now see a theme among even other sectors and other partners who I think a lot of people are finding this convergence of conversations where we all recognize how interconnected we are and how to really accomplish each of our individual missions, that will be done by doing more cross-collaborative conversations. So there's implications for that for policy, right? I will have a session later today, I will talk, there's a lot to say about nutrition programs that we all can work so closely on. There's a lot also, and we have to and will engage and spend the majority of our time there. We have to look beyond that. We have to be aware, if not engage on so many other things, if we really want to help the individuals that we're working with. Thank you.
Thank you, Robert. And we will move on now to Tatiana, the same opening question, addressing the challenges and opportunities in building healthy and equitable communities and the opportunities seen toward breaking through the challenges and toward a path forward.
Good morning, everyone. I represent the community in this panel, and I've had the pleasure to really be working for the last 10 years with hundreds and hundreds of families in the Latino neighborhood in Milwaukee. And that experience really gave me a lot of understanding. You might see me as Latina imagining that I know what Latinos think, but the Latino group, as many other communities, we are extremely diverse inside. So I've got to learn so much, and I keep learning about who the Latinos are in this country. And talking about the challenges, one of the things that I've seen working for 16th Street Community Health Center, just last week, 4 pregnant Mexican immigrants didn't want to sign up for Medicare, even if they have the right to do so, because they are going to have a U.S. citizen. They didn't want to sign because they heard that they might be subject of they might be questioned if they want to apply for citizenship in the future. They might be something called public charge, and so if they wouldn't, they could be deported. They would have the citizenship denied. So that's one example how the political uncertainties can impact the work we do every day in the agency, and how we need to create different mechanisms to solve those things. We are trying to serve thousands of families. But this political climate obviously is affecting our work, but more importantly, it's affecting how is the mental, physical health of entire communities that have consistently been marginalized, constantly. So we're not just talking about some minority group. If the census projections are correct, in 30 or 40 years from now, Latinos are going to be 1 out of 3, not 1 out of 6 like is today. So we're going to kind of double the numbers. And collectively, the minority groups that today are the minority of the U.S. population, in 30, 40 years from now are going to be 57% of the US population. 57% is going to be the majority. So really, when we think about helping those in need, the minority, people of color, or the low-income individuals, we're not just talking about minorities. This is the future of this country really depends on how well and how healthy these communities are going to be. So, and that's where our challenge and our opportunity is, because we are all working for communities that are underserved, and how we're going to start doing connections. I think everything is about collaboration, that's right, but I think we have been doing over the years a very great job collaborating. I think we hear the success stories in the breakout sessions, but the question is, when are we going to incorporate the main partner in the room, which is the community? We keep working for the communities, but we're not working with the community at the table. So I think that's the main challenge that we have, but also the opportunity. So for now, I'm going to leave it.
Thank you so much, Tatiana. So let's give a hand for our panelists and those opening remarks. Hopefully that was a little bit of inspiration for the diversity that we have, and yet what I would call solidarity in everyone from various sectors, from our community to a national nonprofit in the hunger space to a Fortune 6 company, and how we're all able to potentially work together on a similar topic. So now we're going to transition to some individualized questions for each of the panelists, and then, as I said, your opportunity yet awaits. We will have a Q&A in the audience as well. So our first question is for Ralph. Can you talk a little more about the work United Healthcare is doing to bring stakeholders together and work together across silos on addressing the social determinants of health?
All right, Michelle, thanks for the question. And a couple things that I wanted to point to what we're doing at United Healthcare to help break down some silos and working across to help improve social determinants of health. I'd like to give you some examples of some recent initiatives, again, that we've undertaken in the past couple of years here. We too, just like many other organizations, have identified that housing is a critical element that determines whether a person has favorable health, good health, or maybe less than positive health. And individuals living in stabilized housing in general have better or improved health conditions or status, whereas somebody who's homeless and living less than stabilized housing generally faces increased challenges in their health or quality of life. Now, some of the recent things that we've done is to improve the housing opportunities in Wisconsin, and I'd like to just share some major investments that we did starting with last year. We did about a $5.3 million investment in creating affordable housing at a unit called the Flats at Grandview Commons in Madison, Wisconsin, to create new affordable housing for individuals. Just this recent February, we made another $6.3 million investment at a place called the 704 Place in Walker's Point in Milwaukee to help fund and build a 60-unit complex targeted at providing affordable housing, but more importantly, part of 14 units of that 60 units is being set aside specifically for veterans and for those individuals facing extreme homelessness. These are just some examples of where private and public sector can come together to impact individuals and families through affordable housing to improve the quality of life they face, and to bring housing, to wrap it around with case management services, and more importantly, with social services supports. These are just some of the examples that we're trying to focus on from our abilities to help drive improve the health outcomes for individuals. I'd like to share another examples of things that we're doing. We're creating a new pilot, and we're bringing some models that we have launched in other states. And this particular program is called My Connections program. Right now, it's going to be targeted and focused on 10 individuals, but it's probably the most 10 vulnerable individuals that we can identify in the Milwaukee area. And what this My Connections program is intended to do, again, is to get individuals housed first, get them the support services of case management, and also get them with wraparound social services. Now, why are we looking at this so critically? The 10 most vulnerable individuals that we have looked at was based on data that we pulled, and more importantly, what we believe we can achieve by getting these 10 individuals in this pilot started is that we should see a reduction in preventable emergency department visits. We anticipate that we will also see reductions in hospital utilization that was probably less than appropriate. And more importantly, we will see an overall reduction in healthcare costs. So when you think about the investment that we make, assume that we would spend $10,000 a year to house somebody. Guess how much we get to offset in potential preventable healthcare costs? It can be as high as $150,000. So when you think about our role as a healthcare company, and you think about our role attempting to help the citizens by simply getting them housed, getting them into affordable housing, getting them, more importantly, stabilized, we have the opportunity to help improve their overall healthcare status. And it's through the collaboration and efforts of United Healthcare working closely with Impact and also working with the Milwaukee County Housing Development to help launch this initiative. So we look forward to sharing more information with you in the near future on that.
Thank you, Rob. So, Robert, coming from Feeding America, this is probably one of my favorite questions. This is a plug for the audience. So for an issue as simple or as understated as mom and apple pie, fighting hunger, it's surprising that collaboration can be so difficult. As someone who every day works on policy in this space, can you speak about what this looks like for you and what barriers you see? I'd ask you how we can all overcome all of them too, but then that would be like literally solving world hunger, right?
Okay, trying again. No pressure there. Great question. So a couple of things come to mind. One, yes, these are pre-planning questions. So what the first thought was, well, there are people involved, right? And there are institutions involved. So it's never as simple as we hope it to be. But a few things that I'll start with, and themes that I'll come back to at the end. One is trust, and two is ask. You don't ask because you don't get what you don't ask for. So I have a colleague from Feeding America here with me today, Rob Friedlander. He's on our advocacy team, especially helping with some of our grassroots work, engaging individuals like you and me, organizations on how to engage and help engage with decision makers to get them to support an issue as apple pie as hunger, right, that we know we have support around. Plug for Rob, doing an advocacy session after this later today to really dig into it. And if that's wrong about what he does, he can correct me there, or correct me. So Rob and I live in different cities. I'm based in Washington, D.C. Rob's in New York. We drove here yesterday from Milwaukee, yesterday morning, and when we got out of the city, GPS said we got on Interstate, was it 94? Right, it said, 120, hour and 20 minutes till the next exit. We're like, all right, settle in. We're in for a colleague road trip conversation, right? I'm ready for this. So we get on the road. I don't know if he had cruise. Rob was driving. I don't know if he had cruise control. Settle into a conversation. We covered family. We talked sports. We talked cheese curds because Rob had been in Milwaukee for a few days. But pretty quickly, as I knew it would, we were deep into a work conversation. A really big conversation around movement building, right? I mean, it's more what Rob does literally in his day job around how do we really harness the energy we have. But we've worked together long enough where I was expecting a great conversation, and we dug right in. So we work on the issue of hunger, right? We know it is bipartisan in its support, right? We know from research and from polls and surveys that the public wants to address hunger. We know that it cuts across geography. There's hunger everywhere. There's willingness to have food drives, to have investment by great partners to address this issue. And we still have so much work to do, right? So we keep coming back to why. What do we do? I think there's so many ways that conversation manifests itself. But I'll get to what I took away that I think it would be helpful to share here from that conversation with Rob. So We were quickly into what does the anti-hunger movement look like. You know, there's examples we were throwing out around meetings we had recently. We're building up to a very important farm bill, you know, the critical part of a farm bill discussion, multi-year farm bill discussion. It has a big moment that's happening right around us now. But we wanted to know, how can we be more effective? How can we harness the vast resources that we are connected to? Right? That's all of you. That's all of the communities we're involved with. You know, it's not just for us, but it's very, very obvious to us. The 200 food banks that we have official contracts and membership relationship with, that is at best the tip of an iceberg. I mean, we don't even know. I'm sure we don't even know the influence we could have, and that we're working with. So we talked about our issues with experience with other issues, other sectors, other social movements, other movements for change. We're talking about personal experience. We're talking about history. It's hard to have this conversation in April of any year, especially this year, without talking about the civil rights movement, Martin Luther King. There's a lot that goes into change, and it's not always fast. But one thing that we came to pretty quickly is that it's about conversation, right? It's about having honest dialogue with individuals and with organizations. So I'll focus on an individual piece first, and then I'll get to an individual level. So where I said at the national level, and I experienced this in other parts of my career, this gets to my first takeaway of trust. Right? So there are a lot of organizations that have at least a shared vision. That might manifest itself in different ways and maybe even a mission. Certainly when it gets down to operations, to maybe tactics, and that for most issues, you need all of the above, right? You need people who can approach issues from different angles. You need to be, we and I need to be humble enough to know when you come to those conversations that I might not have the best idea for what we need to do to overcome a hurdle. We need to have, I think the key takeaway that we kept coming back to, and I heard in a lot of our different cross-sector conversations, Rob had some experience with this as well, getting in a room, one-on-one, but especially broadening out that group, and being honest about what we bring to the table, trusting each other that at the end of the day we are working toward that common goal, and start there, and believe each other. I'd probably add trust but verify, let's be honest. If we're being honest, these are hard conversations, and we need to verify, we need to build trust. Trust comes with time and with experience. But embracing the fact that you're going to have some groups in any social change movement that are going to be more likely to be more on the maybe civil disobedience side, right? Maybe have a plan, have a tactic to go out and do things that get attention, that make headlines, that might have them get arrested for an intentional purpose. You have other groups that will never go there. And it's very important. Certainly, let me pause here. I'm not sure where Rob's going to go with his advocacy training. I'm not saying he's going to train anyone to plan to have civil disobedience or get arrested for the anti-hunger cause. I'll let him play that out in that session. But knowing that there's, for an issue that's both as supportive, but also honestly as hard and as fundamental as food and as fundamental as hunger, there's reasons we're still struggling with this, and we're challenged to make this find permanent solutions. And all the issues that we're talking about are all to my mind, all part of the answer. But some of that has to be have the trust, have the conversations, be honest about the fact that we'll take different routes. I think that's another missing piece, is acknowledging the fact that we might have different approaches and different tactics, but not letting that be a reason not to work together or to mistrust, but a reason to even stay closer and to share when and why. If we have concerns with that, have the conversation about what those concerns may be. So if we really do share visions, we can all come together around that. The other piece I'll just tee up, because I think we'll get into this later, is if you don't ask for it, you won't get it. So I think there's a lot, certainly in a farm bill conversation, and other, but it crosses issue areas. There's so many people who will engage with us on the issue of hunger, and we need to ask them. Often they just haven't been approached, right? We've dealt with this in the agricultural community at the national level. There's obvious connections, and certainly throughout our network and throughout the work that we do, there are transactional relationships with farmers and with anyone in the food system. but sometimes we might not have asked if they want to engage in a new way. And similarly, we have to be ready for a reciprocal conversation around how can we engage with them. So all important things to make sure that we're moving forward, we're challenging ourselves, we're challenging the efforts that we do to find new ways to chip away at this issue.
Thank you, Robert. I can't wait till the audience questions. So last but not least, Tatiana, your pre-planned question. Can you talk about the differences between equality and equity and about the importance of fully engaging and listening to the community as a key driver for healthy, equitable communities?
Thank you. When we think, I think equity and equality, they are looking for the same goals of justice and fairness. However, the process and the end goal is kind of different. I want to just go to clear examples, what I see happening in the communities. Let's see that in the north, in the communities of color that I've seen, when there's snow, there's a lot of snow, let's say until noon. It's an example. It's not happening every time. But when you drive through other communities, the snow gets clean. When we ask the question to the person at the city that works around the cleaning the snow, she says, we send to every area the same number of trucks. So that's equality. They are sending the same number. But that's not enough to cover the needs of the different communities. So the result at the end is not going to be the same, and that's what we see. I want to give an example of something that also very connected with this. These are the words of a woman that talked to me in a group. We were having a group conversation, and she was saying that her name is Teresa. And she was saying that when she leaves her house in the morning to take her kids to school, she has to grab the kids with both hands and run to the car. Run at 8 in the morning. Why do you think she does that? She lives in a block that there's gun shootings, day or night. So she needs to run to the car. At the same time, we know that the streets in the same neighborhood are not safe. We know that they are not safe, but last year we did a bikeability and walkability assessment with residents. And we walked through 500 blocks, both sides. We had different questions to observe the environment. We walked through the main roads, the main streets, not the inner ones. We found that 52% of the streets didn't have crosswalks. So by design, when you don't put crosswalks on the streets, that's an invitation to cars to run. And that's what happens. So when people like Teresa wants to cross the street, even to the school, the cars are running. So she doesn't feel safe after she parks the car and goes to the school. She doesn't feel safe to walk on those streets. Let's not even talk about bike lanes. That's there to bike on those streets. And so the question is, what are we doing to provide a safe environment for Teresa? Because we can talk about access to many things, but if she feels she lives in fear, she's not going to be healthy. She's not going to walk to the store. She's not. So there are different different aspects that are affecting Teresa's health, mental health. So now, what's the connection with Teresa with community engagement, or with the second part of the question? We talk a lot about community participatory research, community engagement. We are doing different things, but are those enough to help people like Teresa? I'm giving an example of Teresa, but the Teresas are in every single community with different challenges. Every neighborhood and every ethnic community has their own different challenges. So when my challenge, I guess, for all of us is when we are doing community participatory research, that's a great step forward and very honest. But is it enough to get 5 health promoters from this neighborhood? And yeah, we did community. When we plan the agenda already, we plan the vision, we plan the goals, we plan everything, and now we just need to get the promoters. And that's participatory research. You see that now when we go to a community and we say, okay, we're going to do this online survey, and it's going to be bilingual, so they can do it. And then we get surprised because there's 1% maybe fill out the survey. But we did it. We did community engagement. We tried to get feedback from the community. Is that enough? Is that the way? So the question is really how we are really doing our work. I like the word trust. That's a key component to do community engagement. It's the same word that we use to do our organizations engagement. We do great engagement with each other, and the same techniques, the same basic techniques, which is how do we earn the trust of the partner, can be applied with the community. So I feel like we are a long way to go to really do community engagement, but it's extremely needed because that's the only way that our results are not going to be just sustainable, but are going to be successful. Thank you.
So big thanks to all of our panelists. Now is the time that you've all been waiting for. It's time for you to actually be able to ask questions. I have plenty more questions, but I think yours will probably be more exciting in terms of engagement with everyone. So is there anyone who has a question for the panelists? Okay, while you're thinking about it, because I don't see anybody jumping up and down, I'm going to do a speed round. Okay, there's one right here in front.
Thank you. Good morning. Raina Andrews, Feeding America, Eastern Wisconsin. The question that was posed to both Rob and Tatiana about really engaging the community and what can we do to work together. And it occurs to me in the system that we've moved away from the people business, right? And you talked about, Tatiana, trust. And relationships happen at the speed of trust. And it seems so simple to me that as a network, we've become, as funding becomes really restrained and restricted to certain things, that we've withdrawn from partnership rather than being open to working together. So it seems that if we all put our piece on the table, we can not only expedite the results in the community, save resources, but really put the people who need us first. So from your vantages in healthcare and policy and community, have you seen examples of expediting this process and really bringing community together for this issue?
Yes, we've got some great examples, again, of what we're doing to help bridge the communities and bringing different constituents together. One of our focuses also last year was addressing the needs of disabled individuals because they do have many challenges, from trying to seek employment to maintaining employment to trying to get their general health in terms of their disabilities back on track, their other health issues. And more importantly, for disabled individuals, they do have higher rates of obesity, higher rates of depression, higher rates of stress. So what did we at United do? We reached out again to 4 large organizations in the state who have strong breadth and reach in serving the disabled population, because we truly wanted to find a way to help those individuals. And we were able to successfully award about $100,000 collectively to the 4 organizations who have strong visibility in the communities that they serve. And the organizations that benefited from the grants that we provided were the ARC Wisconsin, Easter Seals of Southeast Wisconsin, Independence First, and Life Navigators. And again, it's trying to understand each constituency, each population, learning how we as a healthcare company can have penetration, outreach, and success in supporting those individuals. This is just another example of the different populations that we're trying to outreach to, because we do serve them.
Thanks. Anybody here on that? No. Go ahead.
Sure. Great question.
Can I clarify? So it's not from communities, it's as us as institutions and organizations, how are we working together? How are we bringing our resources together to make an even greater impact? That's really the question.
So one of the things that we did is we did meet with these organizations to try to better understand the needs of the individuals they serve. So we did meet with them, we interviewed them, we asked them, how can we as an organization better serve you? Where are your greatest challenges? Where are your barriers? Where are the pipelines? Help us understand your work and what challenges you're trying to overcome. And that's how we were able to identify the right organizations, understand their funding needs so that they could better continue the programs that they were offering, or expand the programs to individuals that they weren't able to reach previously because they didn't have sufficient funding, to your question earlier. So I think it's incumbent upon us as an organization, all of us, no matter where you're at, to understand the needs and how to figure out to solution together with those organizations.
Add two points or so, because I think it's a vital question. From a couple of thoughts just from national office lens that I have. And there's a lot of funders at the national level, a lot of foundations are asking these same hard questions, right? Are really a part of forcing, a part of what I see as somewhat of a shift in making sure that we are having comprehensive conversations, that we're not still just siloed and just talking about food, but we're having broader conversations. And Feeding America's dabble with that in a little bit with our network. I mean, we of course are, as a national office, don't naturally have connections only so far down formally, but we want to find ways to encourage and to provide resources to food banks that can seed some of those conversations that are vital at the local level. One thing I didn't mention, but thought through for some of the prepared remarks. Look, these are hard conversations, right? If we're being honest, this will often put us we are in competition for funding with some of our closest partners who we work with very closely for everything. That's okay. That's natural. That can coexist. We still need to. I think we're better off if we put that on the table. At least are honest as much as we can be about those things and find ways to collaborate. The other thing that I see playing itself out across our network, and it's happening at the national office, and I think important ways for us is having some kind of very direct connection up and down the kind of network that we work with. Right? Food banks often have versions of some kind of advisory council where it's not just a question on the survey, is there a hope to get input from a community, but that could be one part of what is often a necessary suite of ways to engage and get feedback and have a feedback loop, where we have feedback loops that are going on, and formal connections with researchers who are figuring out how do we have this ongoing conversation. We're working with, it's often at a pantry level of a human-centered design. How should we physically design our space that is inviting, that is designed in a way that's going to let people feel connected and get them more engaged in the resources they need.
Sure. I just will go quick. I think that there are several collaborations happening. I see that all the time from researchers to community organizations, even with businesses. I think that with the government, I think that's happening a lot. There's so many cases. Again, my point is how we are collaborating with communities. One example right now in Milwaukee, we are having we have different organizations working for safer streets in the city. But again, it's organizations, a group of organizations, and we're working with the city. But where is the community? Where is the community? Where is the voice of the community in the decisions that are going to be made for the community in those streets? The community is always absent. So 16th Street is going to, this year, hopefully we're going to convene a group of community leaders from the neighborhood, residents. And so that could be a partner that these organizations can partner with. So it's not like you need to knock doors, but there's a group of community-led Safer Streets campaign that's something we're trying to do.
Thanks, so great question, Rita. I think what we're hearing is there's competition within something that is so good for everyone. And so I think trust is another word that's reverberating really from all of our panelists, and leaving the room thinking about, so when you go to a meeting, how do you show up, be open, have trust, and start with good intention first? Because in the end, we're really trying to feed people who otherwise are dealing with poverty, vulnerability, food insecurity, and the challenges that go around that. So even though there are those competitive issues for things like funding or what space are you in, how do we actually come to the table together, because we still have a need in our state.
And so when that need is finished, maybe we don't need all of this. But for right now, what we're hearing, I think, from all the panelists is to listen to our community. And right now, our community needs us. Everybody in this room working together, and many more who are not here. So, more questions from the audience.
My question, I think, is for Ralph to start, and probably would move on to the other folks as well. I think it's really exciting to see a company the size of United Healthcare involved in this conversation, and the efforts that you've mentioned so far are fantastic. I wondering if though a lot of those efforts are sort of in a reactionary space where otherwise, are there plans with United Healthcare to bring pressure to bear on a state or federal level about the structural issues that create the situation that we're all dealing with? It seems like UHC has power and access and assets that are unique probably in this room, and I was wondering if that's part of your plan to work with the policymakers to produce some changes that make these downstream things less necessary, because the policies that can be effective have some traction at the state and federal level.
To avoid reverberation, we'll just stick with the mic. Yes, we are doing that. One of the things that I think, as you said, puts us in a fortunate position is we're a national company. We operate in every state. We have very favorable relationships with the different forms of governments that we work with at the state level and the local level. For those of you who know us, obviously, in the division that I'm in, we support the underserved. We deal with Medicaid. We deal with dual SNP individuals. And one of the things that we've been fortunate enough to benefit from is many of the states have recognized that we do, as you said, bring certain assets and skills and experiences to the market and are viewed as a subject matter expert in many areas. And that allows us to open up the doors for some very, very good advocacy discussions with the states and the governments that we work closely with. And we do have the ability to take and demonstrate best practices from one state, show them the results, show them why it's of their interest and benefit, how we're impacting the populations that we serve. And obviously in every state, when you look at the Medicaid budget, it's the biggest portion of most states' budget, and they are trying to find ways to continue to deliver the best form of healthcare services, but yet control healthcare expenses. And that's where a company like us comes into play, because we do operate in many markets. We can show them technology, we can show them healthcare benefits and results, some of the different things that we're doing. And as you said, you know, it took us a while to also get to a point to recognize that we can't just simply focus on clinical care. We have to look at the broader picture of social determinants, looking at food, hunger, transportation, social connections, because we as a company deal across the entire age spectrum. You know, children, adults, childless adults, and seniors. So we are tasked with the challenges of trying to figure out how to support the entire spectrum of the population. And I'm grateful that I work for an organization that does have the ability to have favorable relationships and be able to create positive advocacy.
I'm going to steal back the mic, since that was primarily geared toward Ralph, to see if there's another question in the room.
This is directed at Feeding America, basically. While the focus has been on hunger, are you finding as an organization that an evaluation of resources in terms of other aspects of caring for those in poverty, such as health equity and things of that nature, what is Feeding America doing to diversify in necessary ways to help build stronger communities?
Yeah, it's a great question. Two things kind of top of mind, right as you were saying that. One example being, and I think some Tatiana mentioned, right? I think many of us have probably seen an image that's going around about equity or equality versus equity, right? Kids at a fence, right? And they're on little boxes, and equality is when they all have the same size box, and equity is when they have, you know, the smallest child has the largest box that helps them see over the fence. I love the next step of that. I can't remember the term, right, where you break down the fence, which I think is what someone said before. I think a question, right? How do we change the underlying system? Sorry, that's a little. I just wanted to get that in because some of the way that I have that sitting on my desk. It's as simple as when we are thinking of our network. We give out a lot of grants to our network, to our food banks for various things, anywhere from outreach around and education and application assistance for SNAP. Even in that scenario, we know now where there are big pockets of underserved communities in the program. We should invest resources and think about how we invest by looking at those pockets that not to make sure we give out the same amount everywhere, but where we look where there's the greatest need and try to think about how we can approach our work with our network to focus on those areas. There's a lot that comes with that. This is departments that I'm not fully invested in, but even in our advocacy work, and Rob could surely speak to this, and I'm sure will in his advocacy piece. So there's so much energy that we can harness from finding the pockets that we're not tapping into yet, right? So the theme is we find where the greatest need is, and we requisitely think about how to invest ourselves and our time to meet those. Not in a way that's we're not in a time we always joke that in DC and so in the House of Representatives and the Senate, all members are not equal, right? Everyone, some are important, but some are just more equal than others, right? It doesn't matter. You just have to invest where you're going to get the most return, and sometimes that challenges the way we've kind of approached things in the past.
Great, thanks. And our last question. It's actually not a question. It's a comment that goes to something that Raina asked our very first question, and it has to do with collaboration. It's something that we all struggle with in the room, everybody, from whatever perspective that you come here. Collaboration is tough. It's also necessary. And if we're going to get to solving hunger, it is the most necessary thing that we have to do to solve hunger. There is an effort that Feeding America Eastern Wisconsin has taken on with some of our members, and Patrick Legal is here from Salvation Army. Patrick and Feeding America, so Salvation Army, Feeding America, and two of our, one is a non-member, and quite frankly, we didn't always have a great relationship with this non-member, and then another member of ours. We are working together. We actually wrote a grant to figure out how to collaborate beyond just the conversation, putting boots on the ground to figure out things like, where do we come together? How do we share? And it's tough work, and I think Patrick could probably comment better than I. It's really tough work to figure out how to collaborate beyond conversation. We're all willing to do it, but how do we actually do it? And we actually wrote that research grant, and once that part is done, we're going to go to really putting the things that we learned together to learn what does collaboration look like in action. So I would encourage you to the communication obviously is important. Trust is the most important thing, but go beyond that and start putting the boots on the ground and start doing the work of doing that hard trusting, the physical trusting, the tactical work that goes along with that. And both Patrick and I probably would be very happy to talk to you about Fresh Start because we're very, very excited about where it's leading us. Even in our relationship with the non-member that's part of this group that is just lovingly coming along to the good of our community. So that's just a comment.
Fabulous, thank you. So I have one final question as we leave. We have about 1 minute left, literally, for each of the panelists, and I wanted to hear one more time from each of them. So we've come here today and you've listened to all of this, and hopefully you're leaving with something. So from each of the panelists' perspectives, what are some practical actions that members of the audience, food pantry staff and volunteers, educators, policymakers, clinicians, hospitals, systems providers, what can they do to take away, to break through, to build stronger, more equitable, and healthier communities?
For us, I think it's about aligning the organization with the corporate and business partners that you want to work with. Many of us have business social responsibilities and goals that we do want to accomplish. It's about finding the right organization and being able to align the goals and the mission to be able to put together an achievable plan.
Honestly, I was going to say something very similar, right? I think I'm sensing that theme amongst ourselves even. I think it's being willing to have those tough collaborative conversations, to know that it is a process, right? While we collaborate, we dialogue, we converse all the time. To do that meaningfully and effectively takes time. And it's okay to take time. It's okay to write grants to find out how to do that effectively, because that will benefit us in the long run. The other piece I'll say, I wanted to jump onto something that was mentioned earlier and prompted by a question, particularly as I'm going to mentally transition to a farm bill discussion for later this afternoon, harness the resources we have at our fingertips, whether that's individuals and communities, and finding ways in an advocacy and education way to understand them, but also to lift their voices and to lift all of our collective voices around the issue. Also, raise the voices of important, trusted partners, right? It might be able to have different doors open to them, might be able to join in partnership to go to meetings to share what we know, what we care about. There's so many examples that I have from my time in Washington, where in lobbying circles, whether I'm there or not, where an unexpected, we had this situation in the last Farm Bill where there's a very well respected and pretty powerful agriculture group that went in at a very pivotal moment in a very contentious Farm Bill debate where the SNAP program was under attack, and went into a member's office who the first thing out of that agriculture member's mouth was, "You can't hurt the SNAP program," right? And that was a game changer for that conversation with that member of Congress, right? And that was years in the building. Let's be honest. Let me be clear. This was years in the building of a relationship, of an understanding, of a trust that we are in this together. That you have a role, that we have a role together, and that it all builds to a moment like that where you have partners that understand how things are interconnected and are willing to speak up for the issues we all care about.
I think this room is full of people that really cares for the communities they serve. The work that is done in Wisconsin and across the country is amazing. There's so much work well done, and we can go beyond that. I think we know there are challenges and collaborations and different things and funding. However, again, I just want to invite you to consider to including the community you serve as your main partner, to listen to them. It doesn't matter if you work in government, in nonprofits, in profits, in all across the sectors. If you will start listening to the voice of people like Teresa, initially we might think that she doesn't know, but she has a different expertise and knowledge that we don't know. And if we hear that and we find the solutions with people like her, we share the vision with her, we share the power with the communities, then our projects and really the communities are going to look very different.
Thank you. So who in here has heard something this morning that has either inspired you or challenged you to leave with something that you didn't have when you came in? Yay, I think it was a successful panel. So I just want to say thanks to all of our panelists. Thanks to all of you from the audience. It's been an honor and a privilege, and I hope to see you again next year. I will turn the mic back over to Emily.
And I just want to echo that. Thanks to Michelle and the panelists, Ralph, Robert, and Tatiana. I know that certainly whet my appetite for what we're about to do and go out to these sessions. Just quick housekeeping. Remember, or I want you to know that there is no place to store your luggage. And so we recommend that you bring it to your cars, perhaps before this session or in between, but keep that in mind. And we'll all meet back here for lunch at 12:45. So have a great, great morning.